Hello everyone, my name is Sasha Molina and I will be presenting on my project titled Improving Discharge Efficiency Through an Afternoon Interdisciplinary Check-In. This initiative focuses on enhancing patient flow and reducing late-day discharge delays in our observation unit through structured real-time communication. In our observation unit, discharge delays continue to affect patient flow and emergency department capacity. On average, patients remain in their beds 30 to 60 minutes beyond the 90-minute benchmark after the discharge order has been placed. Most of these delays occur in the afternoon when communication tends to break down, and staff are juggling multiple competing priorities, such as new admissions, test results, transportation coordination, or family needs. The purpose of this project is to explore these inefficiencies and determine how structured interdisciplinary communication can close the gap. The proposed change is a secure chat afternoon check-in supported by a standardized checklist. This tool creates a shared space for updates and accountability without pulling staff away from their workstations or doctors away from the bedside. Through leadership interview and SWOT analysis, I identified both the strengths and barriers influencing discharge timeliness. The gap lies in the afternoon communication. So after morning rounds, which is around 10 a.m., there's no structured process to ensure updates are shared, leading to discharge order to exit delays of up to an hour beyond the target. Strengths include a collaborative culture that's already set and a well-established 10 a.m. morning huddle. Weaknesses include patchy afternoon communication and inconsistent provider engagement, especially among rotating providers. Opportunities center on leveraging our existing secure chat platform to standardize updates, and threats, as with many initiatives, are competing priorities, right? And risk of provider resistance. Research supports this direction. Studies show that structured team communication strengthens role clarity and efficiency, and that standardizing workflows can meaningfully reduce discharge delays and hospital congestion. This change is straightforward. So first, implementing a daily afternoon secure chat check-in, embedding it into our culture where nurses, case managers, and physicians all know to take that step. Second, use a standardized checklist or a dot phrase to easily add into the secure chat that will document discharge readiness, such as covering orders, transport, medication, and patient education. Third, ensuring leadership monitors compliance and discharge order to exit trends to sustain accountability. Evidence from recent studies highlight that electronic coordination tools enhance interdisciplinary communication and reduce documentation errors. Likewise, structured nurse-led discharge planning has been shown to improve readiness and lower readmissions. These findings just reinforce that process structure, not just effort, drives better outcomes. By implementing these interventions, we expect several measurable results, right? So the first would be a reduction in the discharge order to exit time, helping patients leave within the intended 90-minute benchmark. Second, we anticipate improved collaboration and role accountability among the team members. Third, by clearing discharges earlier, we help decompress the ED and support better hospital-wide flow. And lastly, patient satisfaction and throughput metrics should reflect these operational gains as well. For sustainability, the plan is to integrate these check-ins into the culture, into our existing governance structure, review compliance data regularly, and embed expectations into our unit orientation or our staff huddles. Transparent sharing of outcomes will keep the team engaged and reinforce that this is a collaborative team effort. In closing, this project connects leadership priorities with frontline solutions. By building on our existing system, we can turn afternoon communication from a reoccurring pain point into a coordinated strength. Improving discharge efficiency doesn't require more meetings, more work. It just requires smarter communication. Thank you for listening. The sources that inform this project are listed here, and full citations are included in my final paper. Thank you for your time.